1. As a nurse on duty, you were performing an assessment to an 81-year-old male, who is having difficulty sleeping at night. Which statement by the client indicates the need for further teaching regarding measures to improve sleep?
A. I love to drink hot chocolate before bedtime. I read for 20 minutes before bedtime. I swim 2 times a week. 2 years ago I stopped smoking cigars.
Correct answer is letter A. I love to drink hot chocolate before bedtime. There are numerous natural sleep aids that can be utilized to affect sleep. However, the client should stay away from stimulants like chocolate, coffee, and tea as well as caffeinated drinks. Upon visitation to your 72-year-old male client, you observe that he is confined by his daughter-in-law to his room. As a nurse in charge, you suggest that he walk to the den and join the family, but he says, "I'm getting in everyone's way, but my daughter-in-law needs me to stay here," which is the most important action for the nurse to take. A. Say to the daughter-in-law, "Confining your father-in-law to his room is inhumane." B. Suggest to the client and daughter-in-law that they consider a nursing home for the client. C. Say nothing, because it is best for the nurse to remain neutral and wait to be asked for help. D. Suggest appropriate resources to the client and daughter-in-law, such as respite care and a senior citizens center. Correct answer is letter D. Suggest appropriate resources to the client and daughter-in-law, such as respite care and a senior citizens center. A nurse's function and duty is to assist patients and their families in learning about the various community support networks that are available. The nurse must act ethically and legally after noticing that the client has started to be confined to his room. Option A is incorrect and judgmental. Option C is not appropriate and is passive in terms of advocacy. Option B suggests committing the client to a nursing home and is a premature action on the nurse's part. Although the data provided tell the nurse that this client requires nursing care, the nurse does not know the extent of the nursing care required. An elderly adult who is being health assessed by the on-call nurse is suspected to have potential complication. Which assessment data would indicate a potential complication associated with the skin? A. Crusting. B. Wrinkling. C. Deepening of expression lines. D. Thinning and loss of elasticity in the skin. Correct answer is letter A. Crusting. Older person's skin typically experiences physiological changes such as thinning, loss of suppleness, deepening of expression lines, and wrinkles. Crusting noted on the skin would indicate a potential complication. The home health nurse is making her first visit to an older adult client. When reviewing the client's medication history, it is discovered that the client has been using 19 prescription drugs as well as a number of over-the-counter medicines. Which intervention should the nurse take first? A. Determine whether a family member supervises medication administration. B. Check for medication interactions. C. Determine whether there are medication duplications. D. Call the prescribing healthcare provider, HCP, and report polypharmacy. Correct answer is letter D. Call the prescribing healthcare provider, HCP, and report polypharmacy. Note the strategic word first. Also note that the nurse is visiting the client for the first time. Polypharmacy is a concern in the older client. Duplication of medications needs to be identified before medication interactions can be determined because the nurse needs to know what the client is taking. Regular health examinations of residents are a requirement of a registered nurse's job in a long-term care institution. Which physiological changes associated with aging could a nurse anticipate to see? Select all that apply. 1. Decreased respiratory rate. 2. Increased susceptibility to urinary tract infections. 3. Increased heart rate. 4. Decline in visual acuity. 5. Decline in long-term memory. 6. Increased incidence of awakening after sleep onset. Correct answer is letter B. 2, 4, 6. Anatomical changes to the eye affect the individual's visual ability, leading to potential problems with activities of daily living are expected. Light adaptation and visual fields are reduced. Age-related changes that affect the urinary tract increase an older client's susceptibility to urinary tract. Change in sleep patterns is a consistent in aging, thus increased incidence of awakening after sleep onset. A 71-years-old female client requests her medication at 9 p.m. instead of 10 p.m. so that he can go to sleep earlier. Which type of nursing intervention is required? A. Interdependent. B. Dependent. C. Independent. D. Interdependent. Correct answer is letter C. Independent. Rationale: nursing interventions are classified as independent, interdependent, or dependent. Independent nursing intervention includes altering the drug schedule to coincide with the client's daily routine represents an independent intervention. Which of the following claims concerning the aging population worldwide is true? A. It is predicted that by 2040 over 25% of the world's population will be 65 years or older. B. The rate of increase in the median age of populations is greater in developing countries than wealthy countries. C. In older age groups men outnumber women. D. Men have a lower mortality rate than women, over the life course. The rate of increase in the median age of populations is greater in developing countries than wealthy countries, which is a fact and it is happening.
Option A, C and D is not true to what is happening in reality.
You were assigned to a 90-year-old male client in the community care unit. Which of the following claims about the diets and nutritional status of older adult persons is accurate? A. Reports suggest that older people consume less than the recommended contribution of fat to energy intake. B. Multiple micronutrient deficiencies are widespread in older people in high-income countries. C. Older people generally have a lower energy intake than younger adults. D. There is little variation in the dietary intake between older people. Correct answer is letter C. Rationale: as you get older, the basic body processes requires less energy. When there is a decline in physical activity and loss of muscles. The nurse has been tending to an elderly client for quite some time. Which of the following factors causes elderly persons to burn less energy?
A. A reduction in lean body mass. B. A reduction in physical activity. C. A reduction in basal metabolic rate.
D. All of the above. Correct answer is letter D. All of the above. Rationale: a nurse must know that the given factors are normally the causes which an elderly person's burn less energy.